Hey there. So in this video, we're going to talk about fluid and electrolytes, and specifically, we're going to get into some general facts about fluid and electrolytes. So the first thing is it's very important to remember that more than half of the body on average is actually made up of water. So as we age, actually, this total body water percentage is going to decrease. So as we start off as infants, that number is almost 80%, as high as 77% water. And then as we age, that goes down. And as an older adult, total body water percentage is about 45%. On average, women have a lower total body water percentage than men. And young infants and older people have more difficult time dealing with fluid shifts that we'll get into at a later time. But just know older people and younger people, it's more difficult for them to compensate for fluid shifts. Fat cells have a lower percentage of total body water than typical cells, and therefore obese patients are going to have a lower total body water percentage. And it's key to remember that fluids are very important for cell life, reproduction, and function as they work to help transportation of cells. So the next thing we're going to talk about is the actual functions of water in the cells and for life. So the first thing is that it's a vehicle of transportation. Think about this in the interstitial spaces as it goes past the capillaries, and then in the interstitial spaces between cells where it's really going to help to move waste and nutrients there. The second thing that water is important for is heat regulation. Think of sweat and how that's going to help cool the body. The third thing is assisting in the acid-base regulation that we're going to get into later, and this is done via hydrogen ions. And the last function of water really is that it serves as a medium for enzymatic action in the digestive process. So the next thing we're talking about is the distribution of fluids. That comes in two ways, really, either the intracellular fluids or the extracellular fluids. So the intracellular fluids are going to be 2/3 of total body water, and they are going to be high in potassium content. Meanwhile, the extracellular fluids only make up 1/3 of the total body water, and that is going to be very important for transportation as it's extracellular and therefore can help move waste and nutrients. There are three main components of extracellular fluids. First is the intravascular fluid. You can think of that as plasma or the fluid in blood cells. And this stuff is very important for electrolytes and for proteins. The next one is the interstitial fluids, and those are high in sodium content, and that's really what you can think of as what surrounds the cells. And it's going to be really important as blood gets down to the capillaries and then into the interstitial space. That's really where fluids are key for transportation between waste and nutrients. And the third is transcellular fluid, which includes things such as the aqueous humor, the saliva, CSF, pleural fluid, that kind of stuff like that.
The next thing we're going to talk about is the fluid balance and what regulates that. So the first thing to talk about is the osmoreceptors, which are located in the hypothalamus, and their primary function is to promote thirst and oral intake. The second controller of fluid balance to talk about is ADH, antidiuretic hormone, which is released by the posterior pituitary and controls fluid leaving via urine and causes kidney tubule reabsorption of water as necessary. The third controller of fluid balance to talk about here, actually a third and fourth in one, is aldosterone and ANP, atrial natriuretic peptide, which also works to regulate fluid balance via the renal function, typically via reabsorption of sodium. Where sodium goes, water flows. The fourth thing to consider as far as controllers of fluid balance is baroreceptors, which are located in the carotid sinus and the aortic arch, and they're going to detect pressure changes and with those pressure changes stimulate sympathetic or parasympathetic nervous system as necessary to change the blood pressure back to baseline. Just some common facts about some of the controllers that we talked about above. ADH is typically released by pain, nausea, or stress. Extracellular fluid volume, or if the extracellular fluid volume decreases or the sodium level volume increases, those are synonyms if you think about it. So if the volume goes down, typically this sodium is going to increase because there's less fluid to dilute that sodium. So if either of those happen, then the adrenal cortex is going to release aldosterone, which ultimately ends in the reabsorption of sodium and then increases the fluid status levels. So the RAS system regulates aldosterone, which we'll get into. That's the renin-angiotensin-aldosterone syndrome system, and renin is released when there's decreased blood flow to the kidneys. Another thing to consider is the baroreceptors. If they sense any bit of stretch, they're located in the atrium there, and if they do realize any stretch, then they will release ANP, which we talked about, which is going to lead to sodium excretion and then decrease the fluid status of the patient, and therefore decrease that stretch that the baroreceptors are feeling. And the last thing, talking about fluid status here before we get too far into electrolytes and everything like that, is just a reminder how important fluids are for the transportation, especially in that interstitial space, which we talked about, which is key for nutrient removal or nutrient delivery and waste removal.